Q1. Why you work this hospital? One reason I'm working at this hospital is that I believe in our mission and values. I want to be part of an organization that puts patient care, compassion, and equity at the core of everything we do. This hospital has a strong reputation for providing quality care and being a leader in the field. Additionally, it is located in a great location, close to where I live, and has a great team of dedicated and passionate healthcare professionals. Q2. Why do you want work here? As I mentioned earlier, I believe in the hospital's mission and values. Additionally, I am interested in the opportunities for professional development and growth. The hospital provides a range of resources and support for its staff, including continuing education, mentorship programs, and networking opportunities. I am also interested in the variety of specialties and departments, allowing me to explore and pursue my interests. Lastly, the hospital's reputation for providing quality care and innovation is attractive to me and aligns with my personal values and goals. Q3. Describe a time that you had to come to a compromise when working with others. One time when I had to come to a compromise when working with others was when I was working in a team on a project. We had different ideas about how to approach the project, and we couldn't come to an agreement on the best way forward. After discussing and examining our options, we ultimately decided on a compromise solution that took elements from both ideas. It was a challenging process, but we were able to reach an agreement and move forward with a solid plan that everyone was happy with and that ultimately led to the success of the project. Q4. What are your career goals for the next 5 years, and how will this position help you achieve them? Over the next 5 years, my career goals as a mental health counselor are to continue to develop my skills and expertise to provide quality care to clients. This position would help me achieve these goals by providing me with opportunities to practice and hone my skills, as well as learn new techniques and methods. Additionally, the hospital's support services and resources would provide me with the tools necessary to continue to grow as a professional and keep myself motivated and interested in the field. Ultimately, I want to be able to offer my clients the best care possible and make a positive difference in their lives. Q5. Tell me about when you failed. As a mental health counselor, the most challenging part of the job is when you feel like you are not making a difference for your clients. One time, I had a client who was struggling with deep-seated emotional issues, and no matter what techniques I used or suggestions I made, I couldn't seem to get through to them. This experience was extremely frustrating and made me feel like I was failing as a counselor. It made me question my abilities and whether I was cut out for the job. Through reflection, though, I realized that sometimes even the best counselors can't save everyone. Q6. Give an example of something you've done or supported that brought a positive change to your work area. One thing that I've done that brought positive change to my work area was when I volunteered to lead a campaign to promote mental health awareness and advocacy at my hospital. As a mental health counselor, I recognized the importance of raising awareness and reducing the stigma surrounding mental health issues. By organizing and leading a campaign, I helped to educate staff and the public on mental health topics, promoted resources and services available for those in need, and helped to create a more supportive work environment. Ultimately, this initiative helped to bring a positive change to the hospital community and helped to make mental health care a priority. Q7. What type of situation at work has caused you stress? What did you do to overcome the stress? As an ICU nurse, one type of situation that has caused me stress at work is when a patient's health condition takes a sudden turn for the worse and we need to act quickly to provide emergency care. In these situations, it is important to stay calm and focused on the task at hand. I have developed a set of strategies to help me manage my stress in these situations, including deep breathing, visualizing successful outcomes, taking short breaks, and focusing on what I can control. Additionally, I have developed strong relationship with my team members and rely on them for support and reassurance if needed. Q8. Explain a situation when you provided patient education and what was the outcome. One time when I provided patient education, I was working with a patient who was newly diagnosed with diabetes. We discussed the symptoms of high blood sugar levels, the importance of monitoring blood sugar regularly, and the role diet plays in managing diabetes. The patient expressed a better understanding of the condition and its management, and had developed a plan for monitoring their diet and keeping track of their blood sugar. This resulted in a positive outcome, as the patient was able to become more self-sufficient and manage their condition better. Additionally, it was encouraging to see the patient take ownership of their health and actively participate in their care. Q9. Name a time you had a conflict or disagreement with another staff member. How did you resolve it? One time when I had a conflict or disagreement with a fellow staff member was a situation where we had differing opinions on the best way to handle a particular patient case. We discussed our perspectives and opinions, and realized that we had different approaches that could both lead to positive outcomes. After discussing the pros and cons of each approach, we decided to approach the situation using both methods, ensuring that the patient received comprehensive care that took into account both perspectives. This allowed us to resolve the conflict while ensuring that the patient received the best care possible. Q10. Tell me about a time when you had to deal with a patient that was upset. How did you handle the situation? As an ICU nurse, one time when I had to deal with a patient who was upset was when I was providing end-of-life care to a patient who had a terminal illness. The patient was struggling with the realization that they were dying and felt like they had been forgotten and neglected by their family. I took the time to listen to the patient and validated their emotions and feelings. I also worked to provide emotional support and reassurance, and reminded the patient of the significance of their life and the lasting impact they had had on those around them. Q11. Why should we hire you? Well, I have the skill set, experience, and dedication necessary to be a successful mental health counselor. I am passionate about my field and have a strong drive to make a positive difference in the lives of clients. I am also a dedicated and hardworking employee who is dedicated to providing quality care and maintaining high-performance standards. Additionally, I am a team player who is committed to working collaboratively with my colleagues to achieve shared goals. Ultimately, I am the right person for this job because I possess the drive, competence, and enthusiasm necessary to thrive in this environment. Q12. What were your responsibilities of your last position? In my previous position as a geriatric nurse, I was responsible for providing care and support to older patients living in a nursing home. This included making sure they had an adequate level of supervision and monitoring their health, addressing any medical concerns, helping them with activities of daily living, and providing emotional support and mental stimulation through activities and conversations. I also worked with the nursing team to ensure that all of the residents' needs were taken care of and that they received quality care and attention. Additionally, I was responsible for maintaining the safety of the facility and ensuring the residents' privacy and safety at all times. Q13. What would make you happy in a job? For me, there are a few factors that would make a job satisfying and fulfilling. These include 1. Meaningful work. I want to feel like I'm making a difference and having an impact with my work, not just going through the motions. 2. Good colleagues. I want to work with people I get along with and who are supportive of each other. 3. Work-life balance. I want to have a good balance of work and personal time, so that I feel like I can devote enough time to both aspects of my life. Q14. Give me some examples of teamwork. Teamwork is essential for success in many fields, and it can take many shapes and forms. Some examples of teamwork include 1. Collaborative planning and decision-making, working together to identify goals, develop strategies, and make decisions that benefit the whole team. 2. Sharing of resources and tasks, dividing work among team members to ensure everything gets done in a timely and efficient manner. 3. Communication and coordination, making sure everyone is on the same page and keeping each other updated on progress, issues, and any other important information. Teamwork refers to a group of individuals coming together to share ideas and collaborate toward achieving a common goal. A few examples of teamwork include 1. Working together on a project. A team may work together from start to finish on a project, with each member offering their individual skills and ideas to ensure results are achieved. 2. Helping each other resolve issues. A team may support and help each other resolve issues or challenges they face individually by providing advice or assistance. 3. Collaborative problem solving. A team may work together to brainstorm solutions to a problem or challenge, utilizing the strength of different perspectives and abilities. Q15. What are you looking for in terms of career development? In terms of career development, I am looking for opportunities for growth, learning, and advancement. This includes opportunities to gain new skills, take on more challenging tasks, and receive recognition for my work. Additionally, I want to work in an environment that provides a good balance of support and encouragement, as well as opportunities to provide feedback and contribute to decision-making processes. I want to continue developing and improving my skills and abilities, while also learning from others and receiving support and guidance from senior peers and leaders. Q16. What techniques and tools do you use to keep yourself organized? I have many techniques and tools to help keep myself organized. Here are some of the main ones I use. 1. A daily planner, to-do list. I use a daily planner or to-do list at the beginning of each day to prioritize my tasks and stay on track. 2. Technology. I also make use of technology to stay organized, such as task management software, reminders and alarms, and note-taking apps. 3. Time management. I also use techniques like blocking out specific times for certain tasks and breaks through the day, which helps me be more efficient and productive. To keep myself organized, I use a combination of methods and tools. My primary tools include 1. Agenda book or diary. I always carry a small notebook or agenda book that I write down daily tasks and deadlines in to keep myself organized. I also use it to note down small details that I might forget otherwise. 2. Calendar reminders. I set reminders for specific dates and deadlines on my phone calendar and work schedule to make sure I don't miss important events and appointments. 3. To-do lists. I keep a running to-do list where I list. Q17. What relevant experience do you have? In my previous role as a geriatric nurse, I had a lot of experience providing care and support to older patients living in a nursing home. This included making sure they had an adequate level of supervision and monitoring their health, addressing any medical concerns, helping them with activities of daily living, and providing emotional support and mental stimulation through activities and conversations. Additionally, I was responsible for maintaining the safety of the facility and ensuring the residents' privacy and safety at all times. I also have experience working in other healthcare settings such as hospitals and clinics. Here is a summary of my relevant experience working in a geriatric setting. 5+ years of experience as a geriatric nurse at a nursing home. Familiarity with a variety of medical conditions and treatments, including common geriatric issues such as Alzheimer's, depression, arthritis, etc. Experienced in providing support and care for older patients, including assistance with daily tasks and emotional support. Familiarity with a variety of elderly care protocols, such as fall prevention, incontinence care, wound care, etc. Q18. A team experience you found disappointing. I will be honest, I have had some disappointing team experiences in the past. One example that comes to mind is when I was working in a nursing home with a team that seemed to have a groupthink mentality. The team was very focused on following a certain way of doing things, even when it wasn't the most efficient or effective method. This lack of diversity meant that we did not always take advantage of each person's unique qualities and perspectives, and sometimes ideas were discounted or minimized. During my time working as a geriatric nurse, there have been some team experiences that have been disappointing from time to time. Here are 2 examples. One time, there was an issue with a resident's medication not being administered properly, and the team members were not able to agree on who was responsible. This led to a lack of accountability and resentment toward each other that impacted the team's dynamic and overall morale. Another time, one of the senior members of the team was being too demanding and critical, which made it difficult to work together productively. Q19. Explain a mistake made in your work and how did you solve or manage it? One mistake I made in the past is when I mixed up a medication dose. The process I used to manage the situation is to take responsibility for the mistake, apologize to the patient, and then work to correct the mistake. I also took the time to review policies and procedures to ensure that similar mistakes would not happen in the future. Q20. Have you ever been upset by the nursing manager? Please explain. Yes, I have been upset by the nursing manager in the past when I felt that my advice or expertise was not valued or taken into account. In this type of situation, I approached the nursing manager with a respectful and professional attitude. I explained my concerns and presented solutions that I felt could improve the situation. I was careful to emphasize the value of collaborative work and team support in order to express my views in a clear and constructive way. The nursing manager's reaction to me was positive, and we were able to work together in a respectful and productive way moving forward. Q21. Have you ever been upset by the colleague? Please explain. Yes, I have been upset by a colleague in the past when they were not treating me with respect or acknowledging my contributions to a project. In this type of situation, I tried to address the issue directly with the colleague. I expressed my feelings in a respectful and clear manner, focusing on the specific behavior that was upsetting me. I also gave the colleague the opportunity to express their side of the situation. I was careful to avoid attacking or blaming the colleague, and instead focused on the importance of teamwork and collaboration. Ultimately, the colleague was receptive to my feedback, and we were able to resolve the issue. Q22. Have you ever been upset by the colleague? Please explain when you late at work. One time I was upset by a colleague when I was late at work and they were not supportive or understanding. It was a frustrating situation, and I was feeling under pressure to finish the tasks I was working on. My colleague was unkind and dismissive, and this made me feel more stressed and upset. I tried to talk to the colleague, but they were not willing to listen and were just trying to get me to hurry up. I felt like I was being treated unfairly and that my need for support and understanding was not taken seriously. Q23. What is the most important and valuable criticism that the nursing director has given you that cause improved knowledge and job? The most valuable and important criticism that the nursing director has ever given me was when they told me that I needed to work on my communication skills. At first, I was upset and felt like they were being too harsh or unfair. However, after reflecting on the feedback, I realized they were right that I needed to work on my communication skills in order to be a more effective and efficient nurse. Since then, I have made a point to work on my communication skills, including taking classes and doing practice sessions, and I feel like I have made significant progress. Q24. What is the most important quality a nurse can have? The most important quality a nurse can have is empathy. Empathy involves having the ability to understand and relate to the emotions and experiences of others. A nurse with empathy is able to truly connect with their patients and provide compassionate and understanding care, even in the most difficult circumstances. Empathy is a crucial ingredient in providing quality patient care and building positive relationships with patients and their families. Q25. Why do you want to work our hospital? I believe that this hospital has a great reputation for providing quality care to patients and providing an excellent working environment for healthcare professionals. I am also drawn to this hospital's commitment to innovation and the latest advances in healthcare. Beyond that, I appreciate the supportive and collaborative culture here, and I believe I can make a valuable contribution to its ongoing success.